it would be purpose. Chike always looked for meaning, the why. Why is this happening? Why him? And through that, being who he was, he needed purpose. He couldn't just have cancer. No, not enough. He had to think of ways to use his story to advocate for others and to improve upon. Chike was hilarious. He was just a force of positive energy. He could do perfect impressions of anyone and could learn just about anything after being shown how to do it once. He loved being part of a team. Whether it was in the Army or the Senate staff, he found great meaning in all things that he was doing. He used to joke about being an inspirational speaker. He used to YouTube the inspirational music and speak over it for me. Yeah. Anytime I had excuses. Good times. He would tell me, don't be so soft, and you could do better. And for whatever reason, this tough love is somehow exactly what I needed. And we figured out a way to keep going together. Keep achieving. He really was incredible. When he was diagnosed with a rare form of diffuse large B-cell lymphoma in 2019, he was studying for the MCAT. He wanted to be an orthopedic surgeon, inspired by his own experience tearing both his patellas in grade school. Again, purpose. He loved using his own story to fuel his passion and help others in similar ways. He was an amazing storyteller, a lot better than me. Something that he would always speak about was things that the way that he spoke inspired you and made you want to learn more. Chike did almost a year of constant treatment, where he tried over 7 different treatment regimens. You heard about some of the gaps that exist in lymphoma research, and that's what Chike's treatment plan was based on, clinical research. But clinical research of who? Who contributes to that picture? Who paints that data that informs the treatment plan? Unfortunately, there are large gaps and issues with equity in cancer research. Some of the statistically underrepresented groups in lymphoma include military veterans, adolescent and young adults, and people of color. Chike intersected all 3 of those groups, and those are the groups that we focus on as an organization. Our mission is to enable better treatment options for lymphoma patients and promote diversity in cancer research, with the vision of saving thousands of lives through improved treatment outcomes. In our first 2 years, we've invested $30,000 to sponsor Dr. Luis Castillo Malpica's work as part of the Lymphoma Research Foundation's Lymphoma Scientific Research Mentoring Program. At the University of Texas MD Anderson Cancer Center, Dr. Malpica, who's considered a junior investigator, investigates treatment options for a rare form of lymphoma that occurs primarily in Latin America and the Caribbean. Since being named the Chike Springer Legacy Scholar in 2021, Dr. Malpica has secured close to $1 million in grant and research funding for his continued work. These small investments and mentorship programs set in motion more actions that help these projects get in front of more people, and the results are exponential, $30,000 to $1 million. Tonight, we're kicking off our Military Veterans Initiative. Again, we're working with our partners. We plan on bringing more support resources to VA hospitals, military treatment facilities, and additionally, we're trying to co-sponsor research that analyzes lymphoma in the military veteran population compared to the average population. Finally, our goal is to sponsor yet another project with the Lymphoma Research Foundation focused on lymphoma treatment in the military population. Together with your help, I know we can get there. As unlucky as we felt sometimes, Chike was always grateful for what we had. We really did have great care and support from all the amazing people from Walter Reed. Thank you for being here tonight. But Chike was the guy who should have made it. He was strong, smart, determined. That guy never gave up. He cared deeply for people and loved taking care of others. He was the person that was supposed to make it. Nothing ever fazed him. He believed in his whole heart that he would survive. In his last 2 weeks, he lost about 30 pounds. He barely looked like himself. His last day, he was so weak, but he was determined to walk into the hospital, trying yet another new treatment. However, he was so sick that his body couldn't handle it anymore. Chike was young, healthy, he was Black, and he served his country. He should have had his whole life ahead of him. And cancer can happen to anyone. It doesn't care how hard you try to beat it. Chike was so much more than a number, a patient, a statistic. Thank you for letting me share your story tonight. I know Chike would be proud. He'd probably tell me to do even more and probably hurry up as well. This started with our story, but it continues with yours, with the patients, the doctors, nurses, scientists, caregivers, family, friends, and supporters. It's hard work, it's uncomfortable work, but it's necessary to find more cures for more people. I wanted to play a song that Chike loved. It was actually from a video of General Martin Dempsey singing at his retirement ceremony. Chike thought it was such an honorable way to say goodbye, and often started many mornings playing the video on our downstairs TV, against my wishes. I want to thank you all again for being here to honor his story and to provide hope to the survivors still fighting today. We're just getting started.